Matching worker training to available jobs in the local labor market is key to forging a successful economy. Connecting Point correspondent Carolee McGrath spoke with Dean Alyce Stiles from Greenfield Community College about a new grant the school has been awarded to help recruit and educate much-needed direct care health workers.
This grant is all about increasing the educational and career opportunities for direct care workers across the state. And here locally in Western Massachusetts, Greenfield Community College is proud to be a grant partner and to help support our different direct care workers.
And who's leading the grant?
The lead grant is, its grant is funded by the Department of Higher Education, and the University of Massachusetts Medical School is the lead grant. There are 6 community colleges partnered on the grant, as well as University of Massachusetts Dartmouth, and several employer agencies.
Okay, can you describe the job of direct care workers just for people who don't know?
Absolutely. Direct care workers are the caregivers that directly connect with a particular person. And that can be a person of any different age, but particularly elders, as we have an increasingly aging population. So direct care workers you might know them as personal care attendants or PCAs. You might know them as home care aides or CNAs, certified nursing assistants or nursing aides. So they might have different titles, but the concept is they're providing care to a particular individual who needs it.
And that's so critical in healthcare, especially as, you know, we do have an aging population and people want to be cared for at home as opposed to going into a nursing home. That is so critical. Don't you find that?
Absolutely, and it is a growing need. More people are needing care, more people are choosing to have care in their homes, and the need is very great. It's the #1 industry for Franklin County, and 18% of our workforce is working in healthcare. And there's a shortage of healthcare professionals right now, particularly on the direct care level. So employers are talking to me all the time saying, when are your CNAs graduating? How can we employ them? How can we partner with you on training? So this grant is helping to continue that work.
And what kind of money are we talking that they make once they graduate from a program, whether you're a CNA or a personal care assistant, you call them?
Correct. Here in our area in Franklin, Hampshire County, our average salary for a nursing assistant is $30,000 per year. And so this work is to encourage people to choose to become a direct care worker and then build their skills. And then the second piece is also helping them on their career and educational pathway in case they want to move on to other healthcare positions.
And it also must be a big challenge to make sure everybody's training is universal as well.
That's right. Greenfield Community College has been on several pilots that have led up to this grant. And so we've been at the forefront of helping to train personal care attendants and then provide trainings that bridge from a personal care training to become a certified nursing assistant. And so what this work is doing with UMass's lead is helping to expand it throughout the state. So Greenfield Community College and those of us who have been at the forefront of this can then share it with our colleagues in other schools.
And do you see, or I know that you're not an economist, but do you see those wages going up in the future as more people get more advanced training?
That's a big question right now, and certainly with a minimum wage discussion that's taking place, that's something that we're looking to see what will happen.
And how important do you think this is for families? I'm sure you must be talking to different families on how critical it is to have somebody qualified and competent to take care of their mother or their father. And it's a huge job, and you also have to have the right personality to go with it.
That's right. We have graduation coming up on Friday, and we have 17 students who bring their families, and we have conversations exactly like that. When we survey our students, we ask, why are you taking this job? Some of them are taking care of a family member. Some of them are looking to take on part-time work or full-time work to become caregivers. Our average age is 37 taking our CNA. So these are returning workers who might have done other fields, but they've got a heart and a passion for it, and these trainings are providing them the skills.
And so you would encourage people thinking about a second career maybe to try something in this industry?
Absolutely. Last year, as one of the pieces going into this grant, we focused particularly on individuals over 50, and we trained them to have the care, because many who were looking for either a career change or have individuals that are in their lives that they want to provide care to, these kinds of trainings give them the skills to be able to do so successfully.
And what kind of programs specifically specifically do you have at Greenfield? So you have the certified nursing program, you have the personal care assistant. Are there other programs that people could choose from?
Absolutely. We do a combined home health aide and certified nursing assistant program. It's a 100-hour, 5-week training that we offer 6 times a year, both in Greenfield and then in Northampton through our partnership with Franklin Hampshire Career Center. And so that provides a lot of individuals who could be universally trained to all different kinds of settings because they have both the home health aide and certified nursing aide credential. And then you mentioned the personal care assistant training, as well as some Alzheimer's trainings that we're doing, because we know that caring for individuals who have mental cognitive impairments challenges is a growing challenge.
And that's a special training as well. I have a friend who was taking care of a family member with Alzheimer's, and it is so hard. Because when I tried to help her, I totally was not helping her. And she was so calm in the way she was talking to the person. But that is a special training in itself.
That's right. It's an add-on training. It's a 15-hour week that's targeted for caregivers, but also family members. My grandmother suffered from Alzheimer's disease, and I told my colleagues I can't wait to take it again because it would help me have more knowledge and awareness. But for people who are taking it for vocational reasons, it provides them additional credential. So if you're a home health aide and you take that Alzheimer's training that's been endorsed by the Alzheimer's Association, then you become a supportive home care aide. And sometimes there's an increase in pay if you have that credential as well. And then for everyone who takes it, it's been something that helps them interact with their patients with more knowledge and skills.
So after 5 weeks, you can get certified. You can. And do you find a lot of people go from that 5-week course and then they start working? Do they go back to nursing school?
Yes, we're tracking that information. Part of this work, as we're working with our colleagues in other regions, is to help show those pathways and those lattices of career paths. So one of the pieces of this grant at the PCA level is a PCA bridge to certified nursing assistant, and then helping provide that academic rigor so that you can move on to other types of professions. Like at Greenfield Community College, our medical assisting program in particular, we've had great success with some of our certified nursing assistants, then move on and go and get continued training.
Okay, so this is a great need. I really appreciate you coming on to talk to us about it, and certainly a need all over of Massachusetts as well. Thank you, Alyce, for joining us.
Thank you for having me.